What if everything you've been calling laziness isn't laziness at all? What if the reason you can't get out of bed, the reason you've stopped replying to messages, the reason nothing feels enjoyable anymore, is something your body and mind have been trying to tell you for months? Today I'm going to show you 7 signs that what you're experiencing is not laziness. It is depression. And the difference matters more than you know. My name is Dr. Alex. I'm a clinical psychologist. And in my years of practice, the most painful thing I hear, more than any symptom, more than any diagnosis, is a patient sitting across from me saying, "I just thought I was being lazy. I was ashamed of myself. I kept telling myself to try harder." They tried harder for months, sometimes years. And it didn't work because you cannot willpower your way out of a medical condition. Just last month, I worked with a 29-year-old man, smart, ambitious, the kind of person his friends called driven. Over the past year, he had stopped going to the gym, stopped seeing friends, was sleeping 12 hours a day, and still waking up exhausted. His productivity at work had dropped. He had started telling himself he was weak, undisciplined, lazy. He had every single one of the 7 signs I'm going to share with you today, and he had been carrying the weight of shame on top of all of it. Shame for something that was never his fault. The World Health Organization estimates that over 280 million people worldwide live with depression, and research consistently shows that the majority of them wait years before seeking help. Not because they don't want help, but because they believe they should be able to fix it themselves. You cannot fix depression by trying harder, but you can recognize it, and recognition is where everything begins. So let's get into it. Sign number 1 is the one that looks most like laziness from the outside and feels most like laziness from the inside. You cannot make yourself do things you used to do easily. Simple tasks. Replying to an email, making a phone call, washing the dishes. Feel like they require an enormous amount of effort. Things pile up, and the more they pile up, the more paralyzed you feel. Most people assume this is a motivation problem, a discipline problem. They tell themselves to just start, just do one thing, and they can't. And then they feel worse about themselves for not being able to. What is actually happening is this. Depression significantly reduces activity in the prefrontal cortex, the part of your brain responsible for initiating action, planning, and follow-through. It also disrupts dopamine pathways, the neurochemical system that generates the feeling of reward and motivation. In other words, the part of your brain that says "let's go" and the chemical that makes action feel worthwhile are both functioning at a fraction of their normal capacity. Think of it like trying to start a car with a nearly dead battery. The car isn't broken, the engine is fine. But without enough power, nothing starts. Telling a depressed person to just try harder is like telling someone with a dead battery to simply turn the key more forcefully. It doesn't work. The problem isn't the key. A study published in the journal Neuron found that depression measurably reduces the brain's ability to initiate action, a phenomenon researchers call psychomotor retardation, and that this reduction is neurological, not personal. The one thing I ask every patient who experiences this: start with the 2-minute rule. Not a to-do list, not a plan. Pick one task and commit to only 2 minutes of it. 2 minutes of dishes, 2 minutes of email. The goal is not to finish. The goal is to start. Because starting is the part depression steals most completely. Sign number 2, and this is the one that breaks the hearts of the people who love someone with depression. You have pulled away. You have stopped returning calls, cancelled plans, said you're fine when you're not, turned down invitations from people you genuinely care about. Most people, including the person experiencing it, assume this is introversion, or being busy, or just needing space. What is actually happening is this: depression hijacks your social reward system. Normally, connecting with people you care about releases oxytocin and serotonin, chemicals that make connection feel good. In depression, that system is suppressed. Connection doesn't feel rewarding. It feels like effort with no return. And so the person pulls away, not because they don't love the people in their life, but because their brain has temporarily stopped generating the feeling of reward from being with them. Think of it like losing your sense of taste. You know the food is good, the people around you are enjoying it. But for you, it tastes like nothing. And eating something that tastes like nothing, while pretending it's delicious, is exhausting. Research published in the journal Social, Cognitive, and Affective Neuroscience found that depression measurably reduces neural response to social rewards, meaning the brain of a depressed person literally processes connection differently than a healthy brain. The daily habit I recommend here: one message per day. Not a phone call, not a meetup, a single text to one person. It doesn't have to say much. It just has to go. This keeps the thread of connection alive during the period when your brain can't feel its value. Sign number 3, and this is the one that almost never gets mentioned, because it doesn't look like what most people think depression looks like. Irritability. A short fuse, snapping at people over small things, feeling frustrated, agitated, or angry, and not understanding why. Most people assume this is stress, or a difficult personality, or just being in a bad mood. Depression, they believe, looks like crying and sadness, so the irritability goes unexamined. What is actually happening is this: depression does not always present as sadness. In a significant portion of people, particularly men and younger adults, depression presents primarily as irritability and emotional reactivity. The brain under depression has diminished capacity to regulate emotion. Small frustrations overwhelm a regulatory system that is already depleted. Think of your emotional regulation system like a dam. In a healthy brain, the dam holds back the water of everyday frustration. You feel it, but it doesn't overflow. In depression, the dam is cracked. The same amount of water, the same small frustration, breaks through and floods everything. A major study in the journal JAMA Psychiatry found that irritability is present in over 50% of adults with major depressive disorder and is consistently one of the least recognized symptoms by both patients and their families. The daily habit here: when you notice yourself snapping or feeling disproportionately frustrated, pause and ask one question: am I actually angry at this? Or am I exhausted and overwhelmed and this just happened to be here? That single question creates enough distance from the reaction to change how you respond. Sign number 4 is the one that most people do not recognize as a symptom at all, because it feels like wisdom or realism or just seeing things clearly. A persistent, quiet belief that things will not get better. Not dramatic hopelessness, not a crisis, just a low-level certainty that effort won't matter, that good things don't last, that the future looks grey. Most people assume this is their honest assessment of their situation. They think, I'm just being realistic. Things really are hard right now. What is actually happening is this: depression alters cognitive processing in a specific and measurable way. It creates what researchers call a negativity bias on steroids. The brain in depression selectively attends to negative information, predicts negative outcomes, and filters out evidence of positive possibilities. The hopelessness is not an accurate assessment of reality. It is a symptom, as real and as neurological as a fever. It is the illness interpreting the world, not you. Think of it like wearing glasses with dark lenses. Everything you see is darker. The world hasn't changed, the light hasn't changed. You are just seeing it through a filter. Depression is that filter. And the filter lies. Research from the journal Psychological Medicine found that cognitive distortions, particularly hopelessness and negative future projection, are among the most reliable predictors of depressive episodes and are directly targeted by cognitive behavioral therapy because they are treatable patterns, not permanent truths. The daily habit I recommend: write down one thing each evening that happened that day that was not negative. Not good necessarily, just not negative. A task completed, a moment of quiet, a meal that was fine. You are training your brain to notice data it has been programmed by depression to discard. Sign number 5 is the one that sends most of my patients to their physician first, and because it is entirely physical and has nothing obvious to do with the mind. Unexplained physical pain, headaches, back pain, joint aches, a heaviness in the body. Fatigue that sleep doesn't fix. Most people assume this is a physical illness. They get blood work. Everything comes back normal. They are told to rest, or to exercise more, or that it might be fibromyalgia. What is actually happening is this: the same neurotransmitters that regulate mood, serotonin and norepinephrine, also regulate pain signals throughout the body. When depression disrupts these systems, the body's pain threshold lowers. Pain signals that would normally be filtered out are amplified. The body begins to hurt in ways that have no structural cause. Think of it like a volume dial on a stereo. Depression turns the dial on physical pain signals all the way up. The music, the pain signal, was always there at a low level. Depression just makes it deafening. The World Health Organization identifies physical symptoms as the primary presenting complaint of depression in up to 69% of cases worldwide. Meaning most people with depression go to a doctor first for physical pain, not emotional distress. The daily habit here: a 10-minute walk outside every single day. Not for fitness, not for weight loss, for neurochemistry. Walking outdoors increases serotonin, reduces cortisol, and is one of the most consistently evidenced interventions for both physical pain associated with depression and depressive mood itself. 10 minutes, outside, every day. Sign number 6, and this is the one I describe as the cruelest symptom, because it takes the things that used to save you and makes them feel pointless. Loss of enjoyment. The technical term is anhedonia, the inability to feel pleasure from things that used to bring it. Your favourite music sounds flat. Food you love tastes like nothing. Hobbies feel like obligations. You go through the motions of your life without feeling it. Most people assume they are just bored or burned out or need a change of scenery. They book a vacation thinking it will help. It doesn't. Because the problem isn't the scenery. It's the system that generates the feeling of pleasure. What is actually happening is this: depression significantly reduces dopamine activity in the brain's reward centers. Dopamine is the chemical of anticipation and pleasure. When its activity drops, nothing looks forward to. Nothing lands. The experience of joy becomes neurologically unavailable. Think of dopamine like electricity running to a set of lights. The lights, your hobbies, your relationships, your food, your music are all still there. But depression cuts the electricity. You flip the switch and nothing happens. It isn't that the things you loved stopped being good, it's that your brain temporarily lost the ability to feel that they are. A study in the journal Nature Neuroscience identified anhedonia as the symptom most closely associated with disrupted dopamine pathways in depression, and critically, as one of the first symptoms to respond when the correct treatment is introduced. The daily habit I recommend: re-engage with one former interest for 10 minutes, even if it brings no pleasure. Not because you'll feel it immediately, but because the neural pathway to that activity stays open only if you use it. Pleasure will return before you expect it to, but only if the pathway is still there when it does. Sign number 7 is the one that keeps people silent for the longest, because it is the most frightening to admit and the most misunderstood by everyone around them. Thoughts about not wanting to be here anymore. Not necessarily plans, not necessarily a crisis, but a quiet, recurring thought that things would be easier if you weren't around, that people might be better off, that you're tired, deeply, permanently tired, of the effort of existing. Most people assume that having these thoughts means something is deeply and permanently wrong with them. They are frightened by their own mind. They don't tell anyone. They carry it alone. I want to say something directly to anyone who recognizes this. These thoughts are a symptom, like pain, like fatigue, like all the other signs we have discussed today. They are the illness speaking, not the truth, and they are one of the most treatable symptoms in all of mental health. But they absolutely require, that you tell someone, a therapist, a doctor, a crisis line, someone. If you are experiencing these thoughts right now, please reach out today, not next week. Today, the International Association for Suicide Prevention maintains a directory of crisis centres in every country at iasp.info. You can also text or call a crisis line in your country. You do not have to be in immediate danger to reach out. You just have to be struggling. And struggling is enough. I want to pause here. We have been through 7 signs, and I need to ask you something directly. How many of these felt like you? Type the number in the comments right now, 1 through 7. That is all. I read every comment on this channel, every single one. And if you have a question, if you're not sure if you want to talk through what you're experiencing, ask it. That is exactly why this channel exists. Now here is what I want you to do today. Just one thing. Say out loud, motitao, not in your head, out loud. I have not been lazy. I have been struggling. And struggling is not the same thing. Because the shame you have been carrying, the shame of not being able to just push through, to just get it together, to just be normal, that shame is not yours to carry. You did not choose this. You have been doing the best you could with a brain that has not been working the way it should. And that is not weakness, that is just human. If this video helped you, please share it right now. Tag someone who needs to hear that what they're feeling has a name, that it is real, that it is treatable. You might be giving them something they have been waiting a long time for. In the next video, I'm going to show you exactly what happens inside your brain during a panic attack, second by second, and the one technique that stops it faster than anything else. It takes 60 seconds, and the science behind it is extraordinary. I'll see you there. I'm Dr. Alex. You are not lazy, you are not weak, and you are not alone.